Today, we're jumping into a really powerful idea: how we can actually design healthier and fairer communities before problems even start. We're going to be looking at a tool called the Health Impact Assessment, and we're using this great guide on promoting health equity as our source. All right, let's just dive right in with a pretty provocative question. Why is your zip code a better predictor of your health than your actual genetic code? It sounds kind of crazy, right? But the data shows time and time again that where you live and work and play has this huge and often really unfair impact on your well-being. So let's break down what that actually looks like. So let's start with something we all need: just getting around. Get this. Almost a quarter of all African American households don't have a car. That's 24%. And that is more than 3 times the rate for white households. Now, think about what that really means. It's not just, an inconvenience. It's a huge barrier to getting to a doctor's appointment, to a better job, or even just to a grocery store with fresh food. It's a wall blocking the basic building blocks of a healthy life.
And speaking of food, the numbers here are just as shocking. Only 8% of African Americans live in an area that even has a supermarket. For whites, that number jumps to 31%. This is what you hear experts call food deserts, and it's a perfect example. I mean, when just getting to a grocery store is a major challenge, having access to healthy food isn't really a choice, it's a privilege. And that creates this serious, daily barrier that has a direct hit on nutrition and health in the long run.
And underneath all of this are these powerful economic barriers. This slide shows that 42% of kids born into the poorest families, well, they'll stay there as adults. And their path is just harder. Low-income students are 5 times more likely to drop out of high school. This isn't just about money. This cycle of poverty creates this constant, damaging stress, and it severely limits your opportunities, all things that are directly tied to poorer health. So, when you start to put all those pieces together, transportation, food, money, you see this unfair health reality taking shape. And these aren't just random coincidences. They are what we call health inequities. These are differences in health that are avoidable, they're unfair, and they're unjust. Now, to really tackle this, we have to get clear on the difference between 2 key words: equality and equity. Equality means giving everyone the exact same thing. But equity is different. It recognizes that we don't all start from the same place. It's about giving people what they specifically need to have a fair shot at the same outcome. It's about leveling the playing field. And that is what brings us to the ultimate goal here: health equity. It's this core idea that every single person should have a fair and just opportunity to be as healthy as they can possibly be. It's not about making everyone's health identical. It's about tearing down those unfair obstacles that stand in the way for so many people. So that raises the big question, right? How do we actually do this? How do we go from just pointing out these problems to actively designing real solutions? Well, it turns out there's a tool made specifically for this. It's called the Health Impact Assessment, or HIA for short. So what in the world is an HIA? The simplest way to think about it is like a health forecast. Before a city decides to build a new highway or pass a new housing law or okay a huge new development, an HIA looks into the future to predict the potential health effects, good and bad, for the community. Okay, so for the more official definition, an HIA is a systematic process. It uses data, it uses analysis, and it uses input from the community to really understand a proposal's potential health effects. And, this is the critical part, it looks at how those effects are going to be distributed among different groups of people. And this isn't just some vague suggestion box. It's a really rigorous, step-by-step process. It starts with screening, just deciding if an HIA is even needed. Then you have scoping to figure out what to study. Then the assessment itself. From there, you get recommendations, a report is shared, and finally, you monitor to see what actually happens over time. It's the whole shebang. Now, here's what's so cool about this tool. It's how it's designed to build fairness right into the process from the very beginning. Let's look at the equity blueprint that makes an HIA so effective. This quote from the source, it really gets to the heart of it. An HIA isn't just for a bunch of experts in a back room. It's a democratic tool. It's designed to bring community members, especially the ones who are usually left out, directly into the process to voice their own concerns, their own hopes.
So what does that actually look like on the ground? Well, a really equitable HIA follows a clear set of principles. First, it prioritizes the communities that are most at risk. Then, crucially, it makes sure those communities aren't just asked for their opinion. They actually help lead the process. The analysis then specifically looks at how different groups will be affected. And finally, it doesn't just point out problems, it recommends real actions for fairness and then monitors the results. It's all about accountability.
Okay, this all sounds fantastic in theory, right? But does it actually work in the real world? Let's jump into a case study to see it in action, the Healthy Corridor for All HIA in St. Paul, Minnesota. So here's the setup. A massive $1 billion light rail line was set to be built, connecting Minneapolis and St. Paul. Now, on the surface, that sounds amazing, a huge public investment promising new development and new opportunities. But there was a major concern. The new train line ran right through some of the region's most diverse and lowest income neighborhoods, including historic African American, Hmong, and Somali communities. And the big question was, would this shiny new investment raise property values so much that it would actually push out the very people it was supposed to help? So, local community groups launched an HIA, putting equity at the very center of it. Their goals were crystal clear: empower the voices of the Hmong, Somali, and African American communities. They focused their research directly on the residents most likely to be displaced. They analyzed the specific impacts on things like affordable housing and local businesses, and then they used that hard data to advocate for fair development. And the result? I mean, this is the best part. It worked. It was a huge success. Because of all the organizing and the advocacy that was built around the HIA's findings, the city of St. Paul allocated millions of dollars in new funding, specifically to preserve and build affordable housing right there, near the new train stations. That is a real, tangible win, born from a community-led health forecast. That St. Paul's story is such a powerful example of why this matters for every single one of us. This is about more than just one project or one tool. It's about fundamentally changing how we make decisions as a society so we can build a healthier future. When you boil it all down, this is the key takeaway. A health impact assessment can totally transform decision-making. It takes it from being this closed-door, top-down process and turns it into an open, community-led collaboration for health. It brings transparency and accountability right to the table. And this work is becoming more urgent every single day. In about 30 years, people of color are going to make up the majority of the U.S. population. If the kind of health inequities we see today continue, our entire nation's health and our economy are at risk. Dealing with equity isn't just a moral choice anymore, it's a national imperative. So I'll just leave you with this final thought. Think about your own neighborhood, your own city. What big decisions are being made right now about transportation, about housing, about development? And which of those decisions deserve their own health forecast to make sure they're creating a healthier, more equitable future for everyone?